Courtney, and I'm going to be your nurse today. Are you having any pain today?
Nope, feel good.
You feel good? Everything? Don't have any complaints at all?
No, not today.
Okay. So what I'm going to be doing today is I'm going to be doing a physical assessment on you. If you have any questions or if you feel any pain during the assessment, feel free to stop me and tell me what the pain is. So first I'm going to do your vitals. I'm going to go ahead and put the blood pressure cuff on. I'm going to feel for your pulse. Once I feel for the pulse, I'm going to pump the blood pressure cuff up as far as until I don't feel the pulse anymore. Then I'm going to let the blood pressure cuff out, noting that number. As I'm waiting for that to rest, I'm going to go ahead and take your pulse. So I'm going to feel for your pulse. I'm going to count your pulse for 1 full minute. Once I do it for 1 full minute, I'm going to note that number. Then I'm going to keep my fingers here as I'm still doing your pulse for 30 more seconds as I count respirations, so that you don't know that I'm counting them. Then I'm going to note that number. I already did the pain. You said you have a pain level of 0 to 10. You have a 0, is that correct?
That's correct.
Okay. So now I'm going to go back to the blood pressure. I'm going to put my stethoscope on. I'm going to feel for that brachial pulse. I'm going to pump the blood pressure machine up into 20 points over what that number was. Let it out slowly. The first sound I hear will be the top number. It's going to get louder, 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 softer, softer, softer until it disappears. That's going to be the bottom number. Then I'll go ahead and let the blood pressure cuff off and take the blood pressure cuff off the patient. So that's the vitals. I got all the vitals. I'm going to write them down on a scratched piece of paper so I don't forget them, so I can chart them after my assessment. Then I'm going to start on the neuro assessment. First I'm just going to look at the face, make sure there's no redness, flush, indicating any pain or fever. Making sure when he's talking to me that his mouth is symmetrical, not any drooping on one side of the face. Then I'm going to go ahead and check the wristband. Make sure, can you go ahead and state your name and date of birth?
My name is Daniel Dvorak. I was born June 12th, 1981.
Okay, so I'm going to check the wristband, make sure that that's right and I have the correct patient. Next, I'm going to have you hold on to both of my fingers, both of your hands, rest them on the bed, and squeeze both of them at the same time. Okay, you can let go. So what I'm looking for is making sure that both sides are symmetrical. You have both of the same grip on both sides. I'm going to do that on the feet as well. So I'm going to just expose the feet. If you can go ahead. I'm going to put my hands here. You can push 3 times against my hand. Okay. Now I'm going to hold right here. I need you to pull your legs towards you 2 times. Okay. So in giving the commands, I'm making sure that you can follow commands. You know what I told you to do. Do you know what day it is?
Yes, it is Monday, February 27th, 2012.
Okay, and do you know what time of the day it is?
7:05 p.m.
Okay, and do you know where you are and why you're here?
Yes, I am laying here getting your nursing skills assessment.
Okay. So you know you're orientated to place, time of the day, what you're here for. Next I'm going to go ahead and I'm going to just squeeze your finger. Do you have any numbness or tingling in your fingers at all?
Nope.
Nope, so you can feel that. There's no numbness or anything. Okay, so next I'm going to go ahead and check your eyes. I'm just going to shine the light on the side of your eye, making sure that the pupils constrict. And I'm going to do the same to the other eye. Making sure the pupils constrict, and they do. Do the same on the other eye. And the pupils do constrict, so that is normal. If you can look at my pen, follow it down to your nose without moving your head. Okay, perfect. Now if you can go ahead and follow it without moving your head, have your eyes follow the pen. And I'm going to do it 3 directions in each way. Alright, perfect. So that completes the neuro assessment. Next I'm going to move on to the cardiac assessment. I'm going to check the S1 and the S2. For the S1, it's going to be on the left side, mid-clavicular. So I'm going to find the midpoint. I'm going to count down 5 intercostal spaces. which is right below the breast area. I'm going to listen for 1 minute. And I'm listening for any wheezing, irregular beats, murmurs, skipping a beat, anything like that. Just breathe normally. So I'm going to do that for 1 minute. Then I'm going to go over to the right side and check the S2, which is right to the right of the sternum, second intercostal space down. And I'm going to listen to that for 1 minute as well. And again, I'm listening for any irregular beats, any wheezing, crackling noises, anything like that, any irregular beats. Okay, so I did that for 1 minute. Now I'm going to ask that I got my objective information, or my subjective information. I'm going to ask the patient, do you have any chest pain, shortness of breath, palpitations while you're laying down?
No. None
at all?
None.
Okay, perfect. So next I'm going to go ahead and I'm going to check the pulses all the way down. There's the temporal, the carotid, the brachial, the radial, the femoral, which is on the inside of the leg, the popliteal, which is on the back of the knee, the posterior tibial, which is on the inside of the foot on the bottom, and the dorsalis medius, which is on the top. So I'm going to check all those. As I'm checking the pulses, I'm going to check the skin for any redness, rashes, swelling, pressure sores, anything like that, and document those as well as I'm doing the pulses. So that completes my cardiac assessment, and then I'll be moving on to the lungs and the GI in the next video.